to also be able to, you guys have some real experts in this space of county folks who have been working on some of these community response guides with us. So hoping we might be able to pull you guys into the conversation on some just real perspectives of what this work takes.
Great.
Yeah.
I'm Lydia Marquez. I'm a Senior Technical Assistant Specialist, and I'm here to support this workshop. So I will be dropping links into the chat whenever needed and supporting our presenters. So whenever y'all ready, please feel free to share your PowerPoint and begin your presentation.
Thank you so much, Lydia. All right, so we'll go ahead and dive in. We have a lot of good stuff for you today, and so we'll get started so we can move through it. The workshop today is called the Community Response Guide, Exploring Mandated Reporters' Role in Prevention. As I said earlier, Claire and I work for a social justice nonprofit organization called Evident Change. Evident Change partners with community professionals in strategic consulting. And we have a ton of different projects that we do at Evident Change. Please check us out at www.evidentchange.com for more info. But one of our biggest bodies of work is called structured decision making. Structured decision making is one of our pieces of work that focuses specifically on helping agencies like child protection, adult protection, and juvenile justice create decision support tools that make better decisions. And we will talk about that in a little bit, but that's a little bit about Evident Change. Claire, is there anything you wanted to add about Evident Change?
Nope, I think, yeah, just, well, I love to say no and then add things. But I think many of you may be familiar with our SDM work, which, as Emerson mentioned, are some of the decision support tools that are used in child protection and support decision-making for child protection workers. And so the community response guide that we're going to be talking about today is really a step outside of that, that space, specifically within child welfare.
All right, so as you can see the agenda on the screen, pretty straightforward agenda for our time together. We're going to talk a little bit about the problem that we're trying to solve. We have some California specific data we'd like to show you today. That's from the most recent management reports. We will talk then about one strategy to helping that challenge that we talk about first, and that's the community response guide. We'll leave some time for questions, and then Claire is going to guide us through an activity where we'll reflect on our own communities and perspectives on reporting. So as Claire said, one of our bodies of work under structured decision making is the community response guide. The community response guide first started in Australia. Australia's child protection was using our structured decision making tools, and they started really focusing on disproportionality in the system around decision making. And they said, hey, Evident Change, we know that the decision support tools that we're using help us make more accurate, consistent, and equitable decisions. Is there a way to apply these tools or the concept of decision making to a decision point outside of the system? Could we create a reporting guide or a decision support tool for reporters in order to help at that decision point? Because what research shows is a lot of the disproportionality within systems actually starts before folks are involved in the system. And so we started our work in Australia in New South Wales. We moved over and did some work with Singapore. We have a few contracts and projects going on in the United States right now. The first ever project in the United States was Humboldt, California, which I know folks are in the room. So Humboldt, California, welcome and thank you for your partnership. We also have a project currently going in San Diego. I also see a couple of my partners from San Diego in here, so welcome and thank you for joining us as well. We value your partnership as well. We have a project going on in Ohio. That one is county specific, but as we move along, we're adding more counties in Ohio. We have a current project in New Hampshire, one in Mecklenburg, North Carolina, And then soon to start, we have a project starting in LA. And so if you are in the room, as Claire said when we first hopped on, and you've been a part of this work, your voice is welcome at any point in the presentation. Please do feel free to speak up and speak out on your experience. I find often I may be an outsider in the room, but tons of peers are here for partnership and good talks, and so want to give space for that where it's needed. So I'll hand it over to Claire, who's going to take us through the problem that we're seeing in California.
Thanks, E. I think this is really exciting, just like having this conversation right after some of the powerful pieces were shared earlier, both about like collaboration with tribes, with community prevention partners, with folks with lived experience, really sharing their stories about when they needed help, but also when the child protection system actually contributed to some of the harm that their families experienced. And I think that's really kind of at the heart of what the community response guide is hoping to respond to. This idea that families should not need to be brought into the statutory child protection system in order to access support, that they should be able to access supports in their communities and stay with their families and access supports in a way that can really be driven by what they're saying their needs are. And also then from the child protection lens, really thinking about what that means for them being able to respond to the families who might most need a statutory child protection response. So I think some of the data that really backs up this idea that currently we are over relying on the child welfare system to support families as kind of this one-stop shop where folks think about, okay, if I don't know how to support a family, maybe I'm just going to make a call. So we kind of, as E said, some of the data that we start looking at is both reporting data and then disproportionality data, looking at who are the families who are being reported. So just wanted to start with just kind of overall referrals and reports that are made in California in 2022. Almost 400,000 reports came in, and about half of those are evaluated out, meaning that those calls are assessed by a screening social worker, but assessed to not be meeting the threshold of needing an in-person child protection investigation. From those calls that then are screened in, we know that a much smaller proportion of them have substantiated allegations or have like a true safety threat that needs to be addressed. As Emerson mentioned, really, we know that while disproportionality gets larger, the deeper a family comes into the system. So knowing that from the time of report to investigation to whether a family actually experiences a removal, at each point that deepens. But to start us off thinking about that from the very time that a family is reported on, that is really where disproportionality begins. So wanted to take a little bit to kind of unpack what we mean by disproportionality before we kind of show a little bit of California specific data. Disproportionality refers to the over or underrepresentation of a particular subgroup relative to a benchmark like their proportion in the population. The difference between when we talk about disproportionality and disparity, we're going to show two different pieces of data looking at the allegation point, so looking at that reporting decision. And with the racial disproportionality, that's going to be looking at how often is a family reported on compared to their rate in the general population. And then disparity, really looking at how often is a family experiencing something compared to another racial group. So we're going to start with that disproportionality looking at kind of children who are referred to child protection or a report is made on them versus their percentage in the population. So I think looking at these top two lines might be most helpful kind of to start. So what you're seeing here is the top bar really indicates for each group what's their proportion in the population in California. And then the second one below is what is their proportion on the referrals that are made to child protection. No, just to pause if there's any initial pieces of what stands out to you, or I could highlight some as I'm looking at this. But as you look at kind of the proportion of children in a certain group in the population in California compared to the number that are on referrals to child protection, what stands out to you? Yeah, Don.
I mean, the obvious is Black and brown children are grossly overrepresented, whereas Asians and white children are grossly underrepresented. Particularly the Asians, where it's a 1-to-4 reverse ratio.
Yeah, thank you. So you're seeing there that the Latinx right here, 40% of population in California, but 50% of the nearly 50% of the referrals that come into child protection. Like here for the Black African American, 5.8% of the population in California, but nearly 11% of the referrals that come in. And then as Don was mentioning, the white and Asian Pacific Islander is actually a less proportion to their population. I think also just to name up one of the pieces of the different looks that we do is that with racial disproportionality, it can be hard to see if a population is pretty small comparative to other groups, that it can be hard to see really what the it can be hard to really see the same level because the percentages are different because that n size, the total number is smaller. So just want to point out here with the American Indian, Alaskan Native, 0.4% of the population in California, but 0.5% of referrals. And that's one that I think is hard to see in this look of how greatly impacted that community is. But when we look at the disparity rate that looks at how often are American Indian, Alaska Native families reported compared to white children, we're able to see that. So this is, as I mentioned, the disparity indices looks at that comparison of an outcome, in this case, an allegation or a report being made compared to white. In this scenario, the white is the 1% or the 1. And this is actually from the California Child Welfare Indicators Project. I know people are probably pretty familiar with this dashboard, but if you aren't, wanted to put this in the chat because this is somewhere where you can actually pull up your own county's disparity index for the allegation rate and see really live what that difference looks like. So let me just, I don't know if any, let's see, let me see if I can quickly post it in the chat, but you're able to, on this website, look at this same look and go to report options and actually see it by your county.
Claire, while you're doing that, we did have a question come up in the chat. It was a bit back. Folks were wondering about the percentage on the substantiation rates. And so we showed what percentage gets screened in or meets the threshold for statutory assessment, but we didn't show the data on substantiation. I don't know if you want to answer that question. I know I don't have specific numbers for California right here as we didn't include it in the presentation. But what I can speak to is national trends, as well as trends in some of the other jurisdictions, would look very similar to what's going on in California. It's like each state is plagued with a very similar problem. And what it looks like in other states is that it's kind of like you cut in half each time. And so of those investigated, which was half of who was reported, of that, about half of those families then receive services. And the substantiation rate is even often smaller than that number. And so I don't have an exact number, Casey. And I think that you may have access in California to get that answer. Claire?
Yeah, I think the that same Berkeley C website you're able to look at allegation rate, which looks at it per 1,000. You're also able to look at investigation rate and substantiation rate. So I think those might be helpful in looking at the kind of county look of what that looks like. And then again, that they have those disparity indices where you can actually look at each of those points and see how that changes across the life of a case or across the decision points. Yeah, Barbara.
Yeah, so I'm with Contra Costa County, and I guess, okay, my question is this. One, I don't like the term Latinx, but that's here or there. My question is this. Back in the time of Trump, they stopped anything that was related to Latino, Latina, Mexican, American, Puerto Rican, so forth and so on, outside of Central American white. Basically, for those individuals that identify in these particular categories, we have to put down decline to state, and then we have to put it down as other ethnicity. So I guess my question is, where are you guys getting your numbers?
Mm-hmm.
Because in California, apparently Latinos and Hispanics don't exist, because we have to decline our ethnicity, and then we have to claim it as other ethnicity. So I'm just trying to figure out how you guys are getting these numbers when, I mean, I filled out enough of these, enough of CWS forms to see that. And so I'm just trying to figure out if we're unable to declare the ethnicity of individuals when we're filling out. And I don't work in ER. I work in continuing, so I'm on the other side. But there's a lot of referrals that come in that become, what do you call it? That get raised. They go from ER to become a court case, and the ethnicity slot is not completed because, it's not being completed. So I know I end up having to complete a lot of those. So I'm just trying to figure out, where'd you guys get these numbers from if Latinx and Hispanics doesn't really exist in CWS numbers?
Yeah. So I can speak to thanks for the question. I can speak to that these are actually pulled from, again, that Berkeley Child Welfare Indicators project site, the ones that we're showing now. And I believe the reports that we build for California use that same methodology for the way that race ethnicity is coded, but I would not pretend to be an expert in how that is done. I don't know if anyone on the call knows more about that, or maybe where we could share more information about it. Okay, so might have to get back to you on the specifics of the methodology, but I do know it mirrors the California Berkeley method. Sorry, I don't have more specifics. So I think just kind of this framing about what we're seeing with reports and the idea that families are very disproportionately even reported to the child protection system for a potential investigation is like the foundation of, again, just thinking about how can we make sure families don't have to go through the child protection system in order to access supports when they need it. I think I'm gonna hand over to you for kind of looking at who it is that's making reports.
Yeah, so let's take a look at who's making reports. So on your screen, you see a list of reporting category or reporter type categories. And so 95% of the reports across California come from the specific groups listed below: school personnel and teachers, counselors and therapists, law enforcement, not reported, or other professionals, which include service providers, and then medical professionals and CWS staff. And so the percentages are listed next to them as well, so you can see about what percentage they account for. And so your number one reporting groups are school personnel and teachers, counselors and therapists, and law enforcement. Those are your top three across California. But the important takeaway that we'd like to look at with this data is not just who they are, but looking at what percentage of the reports they make actually make it into being screened in, or child protection accepting the case and saying, yes, we're going to go out and make a visit with this family. And so of all the reports made by teachers, about half of those were screened in. You can see the in counts underneath each type, which shows the amount of reports that came in. So of the 88,406 reports from teachers in 2022, about 48% of those were screened in. Even less for counselors and therapists, about 36% of those were screened in. Law enforcement has a little bit more at 67%. And then you can see the other ones as you go down the list. And even the highest percent is only at 67%, with the lowest percent coming from counselors and therapists at 36%. And so, we took a look at the overall screen in, screen rate for California. This breaks it down a little bit by reporting type, which gives us a little bit more information. And as a part of the community response guide projects, which we'll talk about in a minute, we try to use qualitative data techniques to dive in a little bit deeper to unpack the why behind the data. One of the techniques we used on our New Hampshire project was a community-wide survey. We also plan to use that. It's actually live right now for our San Diego folks. If you go to the next slide, Claire, I just wanted to highlight, this is not California specific, but this is from New Hampshire, but I think it tells a telling tale, which I have a hypothesis that we will also see in some of the other areas other than New Hampshire. And so this is looking at over-reporting as a concept. We asked folks, had they ever made a report to child protection when they did not suspect abuse or neglect? And of 450 participants, 43% of participants said, yes, I have made a report, even though I did not suspect child abuse or neglect. Some of the reasons why they made the report, you'll see to the left of that. And so the biggest percentage was to protect my organization from legal responsibility. Other folks said they didn't know of other resources, or they were unsure what to do. Some folks flat out said they didn't think anything else was possible. And so this slide really gets into the culture of reporting, right? When you have a mandate to report and you train folks to say, if you even have an inkling, if you don't know, if you have any concern, just call. You create a culture in which folks report for reasons other than genuinely suspecting child abuse or neglect.
I think the survey data for me, I don't know about anyone else in the room, but if you remember one of the first times maybe that you yourself had to grapple with like whether to make a report to child protection, I think I was deeply impacted by who my supervisor at the agency that I was working at as a very young social worker, how they guided me and what their framing was. And I was lucky to have somebody who really valued the idea of talking with a family before you make a report, like bringing your concerns about, I was working in a homeless shelter. And so it was bringing the concerns that often we were seeing that were about, of course, families in the shelter, like their whole lives are exposed. And what does that mean when you have so many people who are able to really watch every interaction that you have with your children? And I think a lot about that first supervisor who really coached me on what does it look like to talk with the family first about your concerns, and talk to them about who they're connected to, and talk to them about what supports they might need. And I know as I went on in my journey that there were other places that I worked that very much had this mentality of, if you have any concern because of liability, we're going to ask you to report it. And so I know there's other organizations in California who are doing a lot of work around really that shift to mandated supporting. And I think this work is really a part of examining those messages that a lot of us received of just, if you have any concern, report, without really looking at what is the impact on families. So that's the next piece we just wanted to kind of pause on. And I think no data could do better than what folks lifted up in the sessions before we came in here. So just naming Gladys and Lorena and Katie really for me, were able to speak to, well, I needed support. There was trauma that happened because of the system involvement. And what would that have looked like to be able to get support not in that way? This is one study that emphasizes that and really looked at for families who were experiencing domestic violence. What did they say about whether when a report was made, did it make things better or worse? And I think this is just powerful. There's the citation at the bottom if you want to look deeper, because they actually look at a bunch of different pieces. They look at like, you know, the family saying, would it impact how I seek services in the future? Would it impact what I want to tell my service providers about what I'm going through and accessing support? And so for those who haven't seen this, I think it's a really powerful look at the many dimensions of ways that families who might be needing support, whether it's domestic violence, whether it's substance use, how the impact of reporting might be pushing them really away from what we're trying to work toward for community prevention services that can support their needs in their communities.
Claire, I'm seeing another question in the chat.
Yeah, thanks. Just reading, Casey, seems like the assumption is screened out cases are not maltreatment, or that unsubstantiated is also not maltreatment. Do you have data by children evaluated by a child abuse team with a child abuse specialist? Casey, are you open to coming off mute and saying a little bit more?
Oh yeah. So I'm a child abuse pediatrician out here in Contra Costa County, and so I have, you know, the medical focus side. I just love what you guys are doing, by the way, and very much support it, and I'm like 99% in agreement. But I always struggle with like CFS related data in terms of child abuse, because I mean, we have lots of cases that are screened out and then later for lots of different reasons, right? So I just like the nuance in like, how many do we know what other professionals had to say, for example, like a child abuse team or a specialist, or do we know how many of those cases that we screen out? Because lots are frivolous, right? Like whatever, anyways, we could go into that, but you know, how many are coming back and later it's determined that actually it did happen or it really was true, you know, so that I like that nuance in there. But
Yeah.
just to clarify, I'm pretty on board with the overall talk and topic.
Yeah, I appreciate that, because it isn't as straightforward, right? As like, because you were evaluated out, there wasn't a concern that child protection maybe should have known about or should have done that screening for, right? Or that because it wasn't substantiated, that doesn't mean there weren't concerns. So appreciate kind of the making really clear those nuances. And I think at each point, even thinking about like, what are the connections to prevention services? Because even at hotlines or even after a family has been investigated, there really are, like you're saying, there might be reasons that there are concerns that were that significant, and there might be ways to really connect that family to prevention at that point, and it not being as black and white as that means that they didn't need support or potentially child protection intervention.
You know, I think that's a good segue, Claire, because I think that might be one of the things that the community response guide addresses for some folks. And so I'm going to take a little bit to talk about the community response guide. And in a few slides, we'll highlight the some groups of folks that maybe have more complex needs, that don't reach the level of child protection. They're getting screened out, but there still are some concerns for those families. So I'll talk a little bit about the community response guide. It is a product. It is also a project, a process. A community response guide product is a web-based tool that anyone can access via the internet. And it's a decision support tool that asks a series of questions after a user selects their concern type. It will ask a series of questions, and then it will guide the user to take an action step. Often the tools are designed with 3 different action steps. One action step, if after answering the question, the information provided reaches the threshold for child protection, which when the tool is designed, that's a suspicion of child abuse or neglect, which is a little bit different than the decision that child protection will make. it's a little bit of a lower standard. We could go into that. I'm not going to go into much detail here, but one of the action types that the tool recommends could be to report. One of the actions that the tool may recommend is to not report, no report needed. But there's also a third option that the tool recommends, and that's a middle ground option. That's a consult. And a consult in some of our other projects is an entity that takes live phone calls from concerned reporters, and they act as a non-punitive case management and education piece for those who are using the tool and call. So one of the pieces of the consult could be to provide a reporter with guidance and information about tool use, but also how to support a family. If that reporter is uninterested in the support, they can then take over and provide the support to the family. And so that's what I'll say about that piece. So the web-based tool is a decision support tool that helps guide users through definitions and examples based on your state statutes through into an action step of 3 different actions. The tool itself is designed through what we call a community response guide project, which includes a data-driven approach with a collaborative team made up of many different local stakeholders, including folks with lived experience, law enforcement, basically everyone you saw in the community or in the reporting type data. We would invite those folks to join our project. We also like to have tribal representation on our project. And so basically the process of coming together and having some of these really value-driven conversations about reporting and supporting becomes a community intervention in and of itself, and allows folks to come to a shared understanding of the responsibility of child safety, and opens the door for other options other than the statutory child protection system. We touched on this a little bit before, so I won't spend too much time there. There's a lot of social science that supports SDM social structured decision making. A lot of that science comes from an individual named Daniel Kahneman. He's an economist. He won a Nobel Peace Prize. But at Evident Change, we are interested in thinking about how the mind makes decisions. And so we know that better decisions are made when complex decisions and emotional decisions are slowed down, broken into smaller bits, and supported with a decision support tool. We have 2 different sides of our brain that help us make decisions. One side I'll call system 1, one side I'll call system 2. System 1 is your Rolodex of memories. It allows you to make decisions based on your experiences. But what we know is that it is unaware of its own bias. So if we can use a decision support tool to trigger your analytical side or your system 2 thinking side of your brain, then we can slow down that decision. And really a combination of your own personal expertise and professional expertise combined with an analytical pause that helps you break down that decision with support of the thresholds really leads folks to make a more informed and equitable decision for families. We test our tools to make sure that tools are helping folks reach accurate decisions. So given the same set of information, would folks come to the same result or same action step? And is that consistent across tool users? And finally, is the tool useful? Does it help reporters make the decision more so than having no tool at all? And so these are the cornerstones of what we think about when we're designing decision support tools. The next slide you'll see kind of raises up that continuum of a family's need. So at the bottom in the green, you see a family is doing fine. As you go up the threshold, you start to see increase of needs. Eventually those needs become so complex or continue to grow, and it reaches a point where CPS intervention may be necessary. Your state law guides when child protection can get involved. And so child protection can only get involved above where it says between 2 safe and may need CPS intervention. And so they're really only designed to take those calls in which immediate danger is present or likely to be present. which is a lot different than a family who has needs or complex needs. So if you think of the tool giving you 3 different action steps, calling child protection would likely help with the first 2 or maybe first 3 buckets you see. A family who has unmet needs or is doing fine may just need a resource, and so that would be what the tool says, no report needed. But those middle buckets of families with significant need for community support, or the folks that may need CPS intervention if they don't get the support they need, can be more readily and easily connected to a service provider through a consult or a middle entity that's not child protection. Claire, do you have anything to add to that one?
No, I think we're going to get into just like what this work. We are aware that it's not just a tool that supports this this large systems change that needs to happen. And really one piece of that kind of related to this slide is that the prevention infrastructure and supports for really supporting families who might be at that yellow middle ground is really needed to be able to complement like a guide like this, because it's about how do community members also feel confident making that connection for support.
Yeah, thanks for raising that up, Claire. So through our learning phase of the project and through unpacking what current practices look like across the United States, we're really seeing that folks start with a concern or a situation that they're experiencing or have heard of. They take that through their own thought process, and then they're given 2 options. Do I report this or do I not report this? And what we hope that the community response guide does is opens up that the opportunities a little bit, and also provides a different level of support. And so folks will still start with a concern or something they're experiencing or have heard about. They'll continue to use their own thought process, but we'll take an intentional pause and use a tool that's collaboratively designed by the community to help them decide not just to report or not report, but opens up the opportunities for supporting in a new way through a consult or an alternative supporting option. And so really what our projects are trying to achieve is a community collaborative space where we develop the tool and collaboratively work to redesign the reporting infrastructure to help support folks to not just be mandated reporters, but also mandated supporters, and also help to open up the culture for help seeking in our communities. And so right now what we're hearing from lived experience folks, which I probably should have told you all this when we first started, but one of my pieces and introductions to the system is through personal experience with the system. And at this point, it feels really policey, right? Like it feels like you have a concern about me and you're telling someone else versus coming to me. And so helping to open up the paradigm for a community to welcome help seeking versus policing. And then ultimately create a system that's more conducive for child well-being. So we don't have families who are continuously being called to child protection, getting screened out, and never getting the support they need. The tool aims to help direct the right families to the right support. This is an example of what a community response guide project looks like. We are currently in stage 2 with San Diego, but the stages are really opening up and planning, creating that core team, creating a theory of change. All of our work is based in the theory of change, which I don't know if we did we include that as a, okay, yeah, Lydia, if you wouldn't mind dropping that theory of change document into the chat. But the theory of change just starts with what the problem is and a shared agreement of what we would want the system or our reporting system to look like if it was different. And then all of our project, we refer back to that as a baseline. We then go into a learning phase where we engage in a ton of activities to unpack the culture climate of reporting. That's including data analytic reviews, that's including getting the community involved through community surveys for mandated reporters, focus groups, all types of initiatives to really understand the reporting climate in the given area. And then we work together to design the tool. We test the tool, which I won't get into the dynamics there, but we have a pretty rigorous testing system that tests for accuracy and consistency of the tool as well as userability. And then we implement while the jurisdiction is working on implementation strategies and rollout. The tool becomes built in an automated system. And then we continue to evaluate across the life of the project and beyond. Evaluation efforts never end. There's continued CQI that will follow the tool as long as it's in use. And so those are the stages. The projects take anywhere from 2 years and beyond. And it requires a dedicated team of diverse individuals to really pull off. Do you have anything else to say about that one, Claire?
No, I was wondering, does it make sense? I know we have like about 20 minutes left to kind of pause for some discussion here.
Yeah.
If that works. Yeah. I know we have a lot of like our thoughts about this in the best case scenario. What does this look like? And like I said, you have some great experts here who have been through this process and can probably speak very transparently to some of the challenges in really developing and changing this framework shift. So want to give space for that, but also questions. So I don't know, does it make sense to do some questions first, or would anyone want to? I see a couple hands up, so if it's okay.
Sorry, Claire, sorry to interrupt. Just quickly, I just wanted to bring everyone's attention to the chat. All of the handouts that Emerson and Claire sent to us are located in the Google Drive, but I did also upload them into the chat for easy access, so you can see those there.
Thanks, Lydia. So what if we see a couple of hands and then wondering, Ivy or folks from San Diego, after we do some questions, if you'd be willing to speak a little bit, or even if the questions speak to kind of like what this looks like in the process, if you'd be willing to share some of your experience. But I'll start, Alyssa.
Thank you. One of the things that I wanted to highlight, and Ivy, I've heard you speak before, and I know you've worked with our director here in Ventura County, and am just really amazed by the CPRG that you have in Humboldt County. I'm hoping eventually we might see some of that work here in our county. But I think the thing that's also really important is while there's good data that we get from CLIP, our data is only as good as the data entry that goes into CWS. But in addition, it would be very interesting. It doesn't highlight the number of calls that actually go into each of our hotlines, and our hotlines are all on different systems. So you can't really track that unless you ask individual counties, but the calls are probably triple fold to the amount of actual reports that actually go into CWS. And that's going to be county to county, depending on your practice and your policy. But our hold times at different county and wait times, I know some counties' hold times are up to an hour and a half because of the number of calls. And just imagine on the other end as a screener, and you see that there's like 50 people waiting. How do you give that caller the time that they need when maybe the report doesn't need to be taken? It's just somebody who needs a consult, but you're pressured for time, and there, I want to just make this report. So you take it, and then it gets entered into the system. And then we have a family that has history within CWS, and that history is there permanently. And so I'm really excited to see this movement for someone that's been working in child welfare for 25 plus years. I think that we still have a long way to go, but I think we're really heading in the right direction in terms of the changes. I'm excited to see San Diego's implementation, and excited to hear from Humboldt, have they seen, I know it's still early in the data, but have they actually seen a reduction in calls to their hotline, reduction in referrals to specific reporting parties? But in general, I'm happy to see the direction that we're moving in.
Thanks, Alyssa, for raising the fact that there are calls that come in that are, and depending on county, how they enter, practice for entering those calls into CWS. CMS, that those might be much larger than the numbers that we showed. And also, I know some counties actually have like formal policy about if there is a certain amount of history, might we respond differently for that family? So just that piece about what it means to continually build history in the system. Yeah, Melissa.
Yeah, I guess I have more of a I don't know if it's a comment or a question, but so I'm in LA County and on the CBO side of things, not with child protection directly, but I guess in conversations I've had over time about this kind of framework shift, right? About just not going right to reporting and more of supporting and everything. I think the thing that comes up most commonly is kind of laws around mandated reporters, and everyone is still wants to cover themselves, basically. And I'm just, you know, obviously we're in a really big county down here in LA County, so it's a monster, but just in general, I'm wondering, maybe it is a question, I'm wondering like, what is the thought around that too? How do we get around that? You know, because I think it's very fear-based, our reporting right now, because everyone is so worried about liability. And is there work being done about changing legislature? I don't know if you guys know, and policy related and all that, but I'm just wondering where that fits in, because I think as long as everyone's, you know, license or jobs are on the line, I think they're still going to have some fear-based reporting. So I'm just, I guess, bringing that point up to discuss, or if you have anything on that.
I actually do have a response for that. So we haven't gotten to that piece or that point in the project yet in the state of California. So to be determined with how California goes. But in our project in New Hampshire, we did. So what we did was we brought in New Hampshire, it's a statewide initiative. And we brought into the core team of the project, the Attorney General. We shared, you know, the AG's office, we shared everything with them. We showed them the tool, we had discussions, and eventually they agreed that if someone uses the tool in good faith, it counts as their mandate to report. And so it would count as that if they use it in good faith and follow the action that the tool says. And so that is basically, you know, changing legislation. Yes, that has to occur. I think it's beneficial to occur. We have other states where nothing like that has occurred and it still, you know, works its way out. But I do appreciate that there's a culture of fear. And so that was one step New Hampshire took. And the other step is training, right? Like we have to revamp mandated reporter training to train about the tool and also discuss some of the impact of reporting out of fear.
Just wanted to add to that really quick. I was thinking also, you know, for the therapists or social workers had the lowest, or clinicians had the lowest kind of rates there. And I think it is because we do have, I'm a clinician also, so we have training on how to ask. It's not like we're investigating ourselves, but how to get more information. And I know, you know, from schools or other mandated reporters, they're just going to go off of what they see. They don't really kind of learn a little bit more. So I think there is a lot of education just on that anyway, and this added layer of the guide too, but just wanted to add that reaction to the data. Thank you.
I can add a little from the Humboldt perspective. That's definitely something we're still up against, is the comfort of reporting and our community knowing that child welfare already houses a lot of information about families. So sometimes it's, you know, there's a worry that this is the one piece of information that child welfare needs. And so we went about it really making sure that it was clear to our community that you don't have to, if it says a report's not required, you can still make a report. It really is it's a voluntary tool, and you can follow the recommendation, but you go with your, you know, with your gut if that's what your heart and head is telling you to do. And then we really just wanted people to know that the guide is intended to work as a funnel, and Claire and Emerson can probably speak to this too, but it's not intended to act as the screening tool in child welfare. It is intended to funnel even ones that will still be evaluated out to the hotline, and really try to put some integrity back, because for here in Humboldt, we went about, ours came about in a really unique way. It was part of a corrective action plan for child welfare. We went through an investigation with the Attorney General's office, and then had to make some pretty significant system reform. And it was like a package of system reform. And one of the pieces of that package just happened to be developing a child protection reporting guide. So it was already kind of launched in a confusing way to our community, because it was something that was that I think our community thought was for child welfare to do better work, and didn't really understand that this is really for the community to be getting us the right reports. And so it's been a bit of a hard sell. But really the whole investigation came about because the community was frustrated with us not responding when they thought we needed to respond. And I think that's not Humboldt unique. I think that happens in a lot of different counties. And so something like this really helps the community know if it says report not recommended and you still call the hotline, you kind of know what to expect. It takes a little bit of that, it gives you that informed decision about if the report doesn't meet the threshold for a mandated report, but I'm still going to call it in. It sort of standardizes that decision making. So that's been some of the process here in Humboldt County.
Ivy. Michelle?
Hi, my name's Michelle. I'm with Mono County. We're a really small rural county in California. And I really appreciate the discussion today. Evident change to me has always been just the SDM tools over the years. So it's really cool that you're doing this work further downstream. I guess just comments, but I really like the emphasis on encouraging mandated recorders to take a moment and talk to families about their concerns. And I think I guess what comes up for me in that is education and training, because we also, it's a fine line between then starting to conduct an interview versus just, kind of putting your worries out on the table. And I think I've done so many mandated recorder trainings over the years with teachers and so forth. And there's a lot of confusion, I think, around that. So, but I do think that the guide would be a really helpful starting place. And then I guess just the other comment, which is just sort of an aside, but I also think sometimes folks just want to talk to a human. I wonder, I'm curious in the counties that have implemented it, if they're really using the tool, because sometimes I've found in a small community, they just want to call and talk to us and be like, okay, here's what I'm seeing. Should we make a report? Should we not? So kind of curious about that, giving folks another tool versus a human being to just call. And then I guess just my last thought was, it also, I think education around, being within the CPS system. I have worked so hard over the years to implement SOP and red teams and so forth internally that, a lot of our education has been around trying to reduce the fear of making the reports, because this has been a food for thought for me, this whole thing, trying to kind of help our partners understand that just because you make a CPS report does not mean we're going to run out into the home and take a child. Our first course of action is referrals and support and all that. But I really appreciate the shift, because we're still CPS workers, and having a community-based person make those initial reports before a CPS worker does that, I think is ideal. So
I can just speak to one piece of that. In New Hampshire, they have a live person to support the community response guide. And so their consult, in addition to supporting families, they also provide support for tool use. And so anyone who uses the tool can call and say, hey, I answered this, but I don't, can unpack the decision making using the tool with them. And so that is a piece that they have chosen to implement into their consult. When you do a project like this, I think the interesting thing about California is your tool likely will look very similar, right? Because everybody in the state has the same threshold of reporting, right? With some minor nuances for some of the outliers. But really your customization is going to come in with how you implement that tool into your current system. And so really thinking about how you're connecting it to your prevention continuum is going to be where a lot of folks in California's focus on the projects will be.
Barbara.
So I guess the three previous speakers brought up a question for me, and that is, so this tool, how will it be available for the public? I guess it's kind of like, so if somebody decides they need to make a report, how would they know to access the tool? first?
Yeah, great question. I don't know, Ivy, if you would want to speak at all to what that looks like for you guys, like how you've, but it is hosted on a public site that's accessible. So it's not like the SDM tools for CPS that are available just to child welfare services. But I know, Ivy, you've done a lot of work of like thinking about where does that live and how do we get the information out to?
Yeah, we're still very much in our infant stages of getting the word out. So we've built the tool, and like Claire said, it is publicly facing. We are looking for another agency to possibly help support training and outreach and education about the tool. We've got brochures, like trifold brochures, and we are, I don't know, I know our county is probably not unique in that we don't do mandated reporter training for the entire community. We probably only really actually train 1% or less of the actual mandated reporters in our community. So we do trainings when we're asked, but most schools, hospitals, they have their own risk management. They have their own insurance that might have a package. I use this example all the time. I'm on the board for my daughter's swim team. So I'm a member of USA Swimming. I have to go through their version of mandated reporter training. So, so getting this word out is a challenge. We can absolutely augment our trainings so that people know, like, as they go through what it means to be a mandated reporter training. And we have this child protection reporting guide available. So we're this year, we're going to be trying to get the word out and augment all those other trainings, like I mentioned, like schools. We're also working on self-guided training tools, really knowing that we can't be everywhere and provide this training. So working with Evident Change on self-guided trainings, you know, interactive trainings where there's quizzes and ways to get them thinking about what the purpose is and how to use it, and having all of that embedded in the tool itself. So one of the first questions is have you gone through training on how to use the child protection reporting guide? And if not, have a link to those trainings. So those are some of the ways. But like I said, we really are in our very infant stages. It's we're trying to get the word out. You know, Child Abuse Prevention Month was last month, so went to the flag raising, gave a quick 10-minute speech about the new tool. So just trying to gradually do more things like that.
And how language friendly is it? So is it available in other languages?
Oh, no, it's just in English. That's a really good question.
So then you are accepting phone calls then from non-English speakers.
We do have the language line for all languages, and we do have some Spanish speaking staff.
Is there any plans? I mean, and it might not be you to answer this question, Ivy, it might be Evident Change. I mean, is there plans to make this tool language friendly? Especially in California, where according to your numbers, you know, not everybody speaks English here.
Yeah, I think we're definitely open to that. In New Hampshire, when we did our outreach, we did everything in, like, our community survey, for example, went out in English and also in Spanish. The tool itself, I'm not sure if it's being developed in New Hampshire for both languages. I think it should be a priority, and I also know that it also costs money. And so I would bet, Barbara, that the biggest holdup is the cost for developing two tools. Not to say that that should be the reason that folks don't explore it, but just giving you an explanation of, in my experience doing this job, that's always the holdup, is that it just costs a ton of money.
We have a couple of minutes, so maybe Don and then Carol, if we can fit it in.
Hi, everyone. I'll try to make it brief, but I think I just want to call out one of the other offices that oftentimes the community or mandated reporters are calling in concerns more related to poverty than anything else, right? And that really speaks to the resource application and connections to resources. I mean, oftentimes those communities really have a barrier to accessing resources. So in Santa Clara County, we partner with our behavioral health services as well as First Five Commission to create more of a resource application hub So we're trying to pilot a neighbor to neighbor model, as well as looking at increasing funding for our partners in the legal area representing parents to provide more of the kind of legal lens when families first receive a call. So they get to check in about their legal rights and get a heads up on what's expected, those kind of things, right? As well as the parent advocates and parent mentors and all those things that we have in place as well. I think the biggest opportunity is really how to partner with mandated reporters on how to build that trust and resource navigation. I think we have a pretty good difference response program where we're sending families to community-based services, just recognizing that there are family stressors that may not rise to the level of a intervention, but that we still recognize that there are family stressors that can blow up more if nothing's done about it. So those are some of the approaches, but I definitely think increasing those partnerships with communities and understanding what's poverty, what's what is more of those complicating factors and concerns, where the community could better respond to them coming to child welfare for all things, right?
Yeah, Don, I think you're really hitting at one of the pieces of the tool itself. And so especially for those neglect categories, which are basically family needs like shelter, clothing, food, hygiene, all of those have what we call sorting questions. And so after we ask about the concern, we use questions to sort out, to try to unpack, is this a situation solely related to poverty, or is this a situation of abuse and neglect? And then the tool sorts through that exact concept. And so it's starting to scratch away at exactly the concept that you're talking about, that conflation of poverty and abuse and neglect. I saw in the chat that folks are interested in more information. I wanted to direct folks to the external Google Drive. I think Claire also put it in the chat for us. But there is a one-pager in that folder that talks, and it has an overview about the community response guide and then gives contact information for reaching out. Claire also put that, like I said, in the chat. And so that's two different ways that you could find to reach out if you're interested in more information or next steps. Claire, did you want to say anything to close us out today?
I don't. I think we have like 3 more minutes. So Carol, I don't know if you I know you've been waiting, if you want to come on into the conversation before we close.
Yes, thank you. As the agency in Contra Costa County that provides most, if not all, of the mandated reporter training in our county, I'm super excited about this tool. And I want to say that we also work very closely with our Children and Family Services staff when we are doing mandated reporting. They do indeed take consultation calls, so they do offer that support to mandated reporters. And just to sort of take the temperature of what's happening in Contra Costa, I think that mandated reporters do want to have this tool, would embrace this opportunity to support a family in a way that prevents that family from, or that child from having to be involved in the system, if that child's safety certainly is the priority. Our biggest barrier with the mandated reporting that we do, because we do a lot of school staff mandated reporting, is the insurance companies. And they have a whole nother perspective on child safety and reporting. And it's always report, and everything else kind of goes out the window. So I think that that's our barrier, our way that we need to really approach this and those insurance companies that you can protect children by providing other alternatives to child safety and to mandated reporting. So it's a challenge, but I think that it's one that we hopefully can all embrace and take part in. So thank you for that.
Thanks, Carol. I think that speaks to the why when we say bringing together folks with lived experience, like that is always something that folks bring up, and hearing just that like insurance, right, and the role that that plays, it's so critical to actually have the voices of folks who are saying like, yes, and there is an impact by doing that. Like, yes, and this is the way it impacts my family. And I think inevitably it is something that we hear often of just folks saying, well, why wouldn't I just report every concern? So I know we didn't get to an activity we want to do about readiness assessment, y'all. As you work on your like county prevention plans, if you're working on the FFPSA prevention plans, we have kind of a readiness assessment. If you want to start engaging in some of these conversations in your counties, it'd be something we'd be
close to 600 when folks went into their breakouts. So see if we get the majority back. All right, well, welcome everyone. We'll get started in the interest of time. So hopefully you enjoyed your workshop.